Hello, my name is Sarah Judd-Lam and I'm the Manager of Policy and Research at Carers New South Wales, which is the peak non-government organisation for family and friend carers in New South Wales. And family and friend carers we will define later, but we essentially mean anyone that's caring for a family member or friend who has a disability, mental illness, drug or alcohol dependency, chronic condition, terminal illness, or who is frail aged. I'm making this presentation today on behalf of myself and my colleague, Dr. Lucas Hofstaetter, and I particularly wish to acknowledge his extensive work on the survey data that I'm about to present. Before I take you through the presentation, it is very important that I take a moment to acknowledge the traditional custodians of the land that I'm presenting from today, who in North Sydney are the Gadigal people of the Eora Nation, and their elders past and present. And I also extend my respect and acknowledgement to the traditional custodians of the lands from which you may be watching this presentation today as an audience. You may notice that the slides I've put up today are in PDF form rather than PowerPoint, just to make it a little easier to navigate in the Zoom format. This presentation is entitled Overcoming the Digital Divide for Carers in Rural and Remote New South Wales, and it draws on work we've done with carers during the COVID-19 pandemic, as well as two carer surveys that we've done over the past 2 years. So firstly, just going back to the definition of carers, when we refer to a carer in this presentation, we mean that an individual that provides care and support to any of those listed. And importantly, this definition does not include paid care workers, former volunteers, parents, foster carers, kinship carers who are not caring for someone with special additional care needs. There are over 850,000 carers in New South Wales and approximately 2.65 million nationally in Australia. I mentioned the evidence base before, so this presentation is based on 2 rounds of consultations with carers and service providers in New South Wales, specifically regarding the impacts of COVID-19 that occurred in April and July 2020. We also did a literature review of published evidence regarding carers and COVID in July 2020, which this draws upon. But predominantly, most of the data that will be presented is from the 2 last biennial surveys conducted by Carers New South Wales. In 2018, we did a statewide survey of approximately 1,800 carers, and just now we've finished cleaning the data set for our first national survey, and we got over 7,500 valid responses. We also have had extensive experience delivering services to carers across New South Wales, including in rural and remote areas. And I'll mention a little later in the presentation the Carer Gateway services, which we, as Carers New South Wales, are delivering in part of New South Wales. Finally, as with other non-government organisations like ourselves, we have had a lot of experience trying to adapt our service delivery to the COVID-19 environment, and that has given us a lot of insight into the experience of carers accessing digital services to complement the evidence that we've collected through our surveys. So the context of the abstract for this presentation and the presentation as a whole is the pandemic, COVID-19. So while rural and remote areas have not really borne the brunt of COVID-19 cases, obviously it's been a statewide and national area of priority for many months now. The main reason I wanted to refer to COVID in introducing this presentation is because COVID has provided a real opportunity to understand how extensive digitisation affects service users, including those in rural and remote areas. So without having to tell you all the details, I'm sure you're aware that the closure and reduction of services, enforced restrictions around movement and gathering, people's anxiety and reluctance to be out and about in the community, reduced face-to-face social contact and engagement, and just a real increase in all kinds of digitised services and online shopping and all those things. We've seen a huge change in a very short space of time in terms of the acceleration of digitised service offerings. There's obviously many opportunities about this period, and really a lot of sort of more optimistic commentators have identified that COVID-19 has provided us a snapshot of a digital future that we might be able to pursue. It's provided enforced innovation in a number of sectors. It's made individuals and businesses upgrade their equipment to be more digital. It's increased flexibility and affordability in service delivery, as well as in workplaces. It's opened up online learning. and it's really led to forced skills development of a lot of the workforce and the community in engaging with new technologies. Potentially, it allows for greater convenience, cost savings, a broader reach, and increased equity in a whole range of service and commercial delivery. And potentially, it offers a view of how things could be always into the future. But obviously, with any innovation comes challenges, and COVID-19 has not only been about digital innovation, but also obviously about huge public health and economic challenges. Similarly, the digitisation of services has brought its own challenges, including to people in rural and remote areas. As a bit of an overview, we're all aware, I'm sure, that not all services offer high quality, engaging, accessible digital alternatives, or in some cases, do they offer any at all? Additionally, not every person can or wants to engage digitally with services. And finally, and most importantly, for the context of an organisation like ours working with a disadvantaged group, there are many, many barriers that prevent individuals from accessing digital services, even if they are available and of a high quality. Key ones we can say there are digital literacy and confidence, but also real resource related issues, such as just being able to afford an up-to-date device, being able to pay for adequate data speed, download speed and data, just practical infrastructure issues around internet coverage and reception that can be a problem in rural and remote areas. And then in the COVID-19 space, you have the issue of competition between household members for use of devices, for use of space, and for privacy. So all of these barriers have been coming into play in terms of the equity of the take-up of digitised services. And these barriers are things that must be considered as we look down the track at how we can learn from COVID, and particularly in how we apply our learnings in expanding telehealth and other digital service offerings. What are the implications of these digital barriers and other issues caused by the rapid digitisation that's happened under COVID-19? Focusing on carers, which is my organisation's focus, looking at some of the evidence that we've collected and reviewed, the closure and digitisation of a lot of health and social services has been problematic for many carers, resulting in less service access, increased caring responsibilities as a result, and just the additional stress of adjusting to new methods of accessing services. Similarly, the restrictions on movement and gatherings have actually led to people having less access, carers having less access to their own informal support networks, which has increased isolation, provided stress around separation from the person that they're caring for, and again, just stress around adjusting to new methods of contact. But what about after COVID-19? As I mentioned before, rural and remote areas have not really been where most, if any, COVID-19 cases have been concentrated. So how do we learn from this period in understanding broader digitisation of service delivery that can be delivered equitably across New South Wales and across Australia, including those living in rural and remote areas? At a high level, some things that we know from the literature about rural and remote carers. About 1 in 3 carers living in regional, rural or remote areas. We know that there are higher rates of disability and chronic health conditions in those areas, therefore a greater need for informal care. We know that there's lower formal service delivery due to distance and low population. We know that high school completion and labour force participation are lower on balance. We know that costs of caring can be higher, and that there can be more socioeconomic disadvantage and financial hardship in some areas. And we also know that there can be real telecommunications issues, whether it's to do with mobile reception, whether it's to do with NBN rollout, lots of barriers that can prevent really efficient use of digital services in rural and remote Australia. There are also a couple of quotes there on the screen from our 2016 carer survey, is the first one in red, from a carer talking about what it's like to be living in rural New South Wales. And a quote as well from the New South Wales Carers Recognition Act, which acknowledges that rural and remote carers face particular challenges. So now onto the more detailed data from the 2 surveys that I mentioned before to give us an insight into the challenges that rural and remote carers face and a better understanding of how we can ensure that digitised service delivery can be delivered equitably to those carers. The Carers New South Wales 2018 Carer Survey had about 1,800 participants in total. And we've just got one table here looking at a few elements of interest. We've broken up respondents here into three main categories based on the primary health network region that they were a part of. So really we've looked at the Sydney region, the primary health networks that contain Newcastle and Wollongong, because they're sort of a mix of metropolitan and regional, and then the non-metropolitan regions, the rest of New South Wales. And what you can see here is lower usage of mobile phone for accessing the internet in the non-metropolitan areas. And that's probably partly due to poor mobile reception. You also have a higher rate of financial hardship in the non-metropolitan areas. But when you look at engagement in the internet, online engagement seems pretty similar, including in online services. Moving to our most recent survey, which we've just started analysing the data from, approximately 1 in 3 respondents from the over 5,000 carers that included demographic details in their responses were from outside major cities. So as you can see here, we've put the remoteness index in our tables, and you can see there that 37.7% were in major cities and everybody else was outside major cities, ranging from inner regional to very remote. And this survey was conducted across all states and territories of Australia, led by Carers New South Wales, but with the support of the state and territory carers associations. This table here looks at wellbeing and social isolation, comparing different parts of Australia. And what you can see is that, contrary to maybe expectations, poor wellbeing and social isolation actually appear to be more of a problem among metropolitan carers than in regional, rural and remote areas. However, if you look at the percentages, there's still quite high percentages of carers in those regional, rural and remote areas that are experiencing high distress and also high social isolation. So those are issues that do need to be addressed. The next slide here looks at access to services. And so what we can see in the first column there is that there's less availability of local carer support services. So that's services specifically for carers in the regional, rural and remote areas. We can see though that the usage of online service options in the carer support sector is similar, but you can notice, especially in the last column around carer specific information and training courses, that overall uptake of online service options is low. There's lots of room for increasing both awareness and uptake of those kinds of services, which I'll get to later. This table here looks at confidence with digital engagement and also financial stress. So as you can see from the table, there's slightly lower confidence levels with digital engagement when you move outside of the metropolitan areas, but really overall there's relatively high confidence with digital engagement. And what you can see is that the lowest element of confidence is around accessing services online, which is quite important in the current environment. Finally, you can see that financial stress, according to this, does not really vary too much once you're moving outside metropolitan areas, but you can still see that about 1 in 5 people in those regional, rural and remote areas are experiencing acute financial stress. So this is only one of the, that column on the right is only one of the measures that we've included in the 2020 survey of financial stress, and that's really at the pointy end. So finishing up, and looking at a summary of the findings presented so far. COVID-19, as we said before, has thrown us really into the deep end of digitisation. Perhaps before we were ready, but there's been a number of opportunities that have come out of that in just really having to have a go. So digital service delivery does actually provide opportunities to improve inclusion and coverage, but for it to work, the barriers really do need to be acknowledged and addressed specifically. As we know, carers in regional, rural and remote areas already face a number of challenges, including socioeconomic disadvantage and isolation from services and from informal networks. And so the challenges that have come from COVID-19 and the loss of face-to-face services and digitisation of services has just exacerbated many of those challenges, whether or not carers are in rural and remote areas or elsewhere. Carers' online engagement, emotional wellbeing and social connectedness in rural and remote areas can all be improved. That's clear from our results. And finally, digital services may help make up for local service access, but they should never replace face-to-face services. That's something that the data really didn't go into much here, but when we were looking at data for preparing this presentation, it was very clear that there was still a real preference among a lot of carers for face-to-face services. And with the digital access barriers, that also emphasises the importance of having non-digital modes of accessing support moving into the future. In terms of next steps, what are our recommendations in order to future-proof digitised service delivery so that rural and remote carers are included? As I mentioned just earlier, ensuring that there's always a face-to-face or at least an in-person option for support. So whether it is a person on a phone, a person in an office, a mobile workforce, having options for not having to go online is really, really critical in ensuring that everybody is included in service delivery and importantly that there's consumer choice. Secondly, providing more digital literacy support. There's a lot of digital literacy support initiatives that have come out of COVID-19. They need to not stop. They need to continue post-COVID-19. And they need to not just target groups that we might expect or stereotype as are in most need of these, such as older Australians. There are many other groups, such as culturally and linguistically diverse Australians and rural and remote Australians who may also have digital literacy barriers that need to be addressed. Thirdly, as I mentioned before, it's not just about digital literacy, and sometimes digital literacy is the easy focus for funding and initiatives, whereas financial support to actually assist with digital access, whether that be at an individual level to purchase a device or upgrade an internet service, or whether that's at sort of societal level with development of infrastructure, that is critical in order to support carers in rural and remote areas to access online services more. Telecommunications infrastructure, as I said, also important. And the final point to make is that the Carer Gateway, which is a new national carer support service that I mentioned earlier in the presentation, is a national service system that includes both digital and face-to-face components. It launched in April 2020, right in the height of the lockdown across Australia during COVID-19, and so a lot of people aren't aware of it. But this new service model essentially is aiming to provide good coverage and inclusion of carers across Australia, including in remote and rural areas. And it looks at a mixed mode of delivery through online and face-to-face. And so it's very early days. Uptake has been a little slower than anticipated due to COVID-19, but I would really encourage service providers and carers alike to find out more about the Carer Gateway, which is linked here, and to just really watch this space and see how the Carer Gateway may be able to improve access in rural and remote areas to services for carers, both by looking at innovative ways of accessing digital options, but also by ensuring that face-to-face options do continue. So to find out more about the Carer Gateway, you can Google Carer Gateway or phone 1800 422 737. And as I said before, Carers New South Wales is one of the 10 lead service providers in Australia delivering this service. We deliver in the Hunter New England, Central Coast and North Coast region of New South Wales. Finally, thank you for listening to my presentation, and I'm happy to take any questions to my contact details in my final slide. Before I move there, just to flick to references, I mentioned a number of different points from the literature earlier and some reports that Carers New South Wales has prepared, which are linked there and mentioned in the references slide. Here's my contact details and our website, and thank you very much for listening today.